Hello, everybody. Hello. Once again, we are starting our next session in a series of EIT morning talks. Session is in our session. So welcome in Dynia Restobar. We are in Kraków. We did have a Klaster breakfast before, so there is some people here still enjoying the food. And today's meeting is focused on still as we continue our activities from started 3 years ago now about innovative hospital. Today's subject, the title of the meeting is Beyond the Money, from Challenges to Solutions in Healthcare Innovation. And today we will have, in the program, we will have a few distinguished guests in that case. We start with some introduction and presentation of the place and the note. Then we start with the keynote speech, which will represent us in the national perspective, European best practice in digital hospitals. Delivered by Sava. I'm not sure if I will be able to pronounce this correctly. Hello, Sava, are you with us?
Yes, I'm here.
Hello.
Hello, everybody.
Hello.
Sorry for spelling your name.
I can almost not hear you because it's kind of noisy.
Yeah, okay, I'll change.
Plates and chairs.
Yes, because we are in the real setting in the bar. But now I changed I took my microphone closer, so it should be better.
Yeah, it is.
Then we will have Anna Gawrońska, and she will Anna Gawrońska from Institute of Mother and Child in Warsaw, who will present our Polish perspective in the same about hospitals of the future in Poland, from barriers to solutions. Then about 11:05, we will have the fireside chat with Dr. Nick Guldemont from Leiden University Medical Center. And then we will have a plenary discussion with stakeholders, featuring Professor Roman Lewandowski from University of Warmia and Mazury and Monika Ślęzak from Łukasiewicz Port, Polish Center of Technology Development. And then we'll wrap up these meetings and still enjoying food here. I'm Kazimierz Murzyn. I'm Managing Director of Klaster LifeScience Kraków. I think I have a very short introduction to our discussion. In this introduction, I just wanted to point out that we are, since a few meetings devoted in the scope of this series morning health talks, we are talking about in which way we can map the way to the hospitals of the future with a kind of approach, a kind of mission to stimulate, drive, and manage the dynamic change while still concentrating on the purpose. So our questions are: what we have to learn somehow on the way. What has to be done in order to map this pathway? What should we learn about that? What should we know? And what kind of perspectives we should introduce in that discussions? Actually, next year we will be in a real case developing this roadmap for the hospital of the future. We'll attempt this. We did some kind of exercise last year, and we have some results, and we will continue. We'll build on that what has been done already, and we'll complement this knowledge, this developments we have now in hand with the other knowledge, with the new approaches, new people working with us. So that's the That's our purpose. Ultimately, we want to have the roadmap to the innovative hospital, and we suppose to learn from you, Sava, and also from other talks, in which way we should go in that direction. Not to continue with that, I will give the floor to our guest. So, Sava, the floor is yours.
Thank you. Are you sharing my slides for me, or?
No, I don't know. I think you can share.
You can
Okay,
share.
I have sent them to Joanna.
Stop sharing, yeah. Okay, now you can share.
I will see if I can do that. Try this.
Okay.
What can you see?
We see your presentation, but not in the presentation mode, but in a program. PowerPoint, yeah.
Okay, I'm not.
So it's enough. It's enough if you click now the presentation mode on the bottom right.
Oh, of course, yes.
This one, yeah.
So, you see the slides now?
No.
Not in the presentation.
So which means you are sharing not the right screen.
Not in the right screen. I will try. How about now?
I think it will be better if you share the whole screen, not the window mode.
Okay.
Okay.
I'm not so used to Zoom, so let me see here. Okay.
Hi, Nick. We can now see you.
Yes. So it's easiest if I share the whole screen or the window.
The whole screen. Exactly.
The whole screen. I think that was exactly what I was doing. So.
Okay. So let's try again.
I will try again.
Okay. Now we can see the PowerPoint mode.
Grzegorz, can you share? Do you have this presentation?
I did send the presentation to Joanna yesterday.
Maybe I can do it. Just give me a moment.
It's easier.
Try to find the presentation from Joanna.
Yeah.
Okay. You know what? Maybe I can share the presentation from my computer. Just give me a moment.
I will stop
receive it.
them.
Okay. Just a second. Okay, you should.
Okay. This will maybe be working better. Okay. Hello, everyone. So apologize for the technical difficulties. It's always exciting to see how it's going to be working. Well, my name is Svava Eholm, and I'm a project manager in the section for green and innovative procurement in the capital region of Denmark. So my vision into this is with the green perspective and how we can engage hospital staff in green transitions. And I'm going to tell you a little bit about how we work with that in the capital region. So maybe a very relevant information is that I'm a nurse. I've been working in Danish hospitals for many years. Been working as a nurse manager for many years. So I know the hospital system pretty well. And now I'm working with how to transform to green practices in the hospitals. So I have to ask you to change the slides for me. Yes, just a short presentation. This is my team. Just to show you, I think there might be some text coming flying in if you press the button one more time. Yes, so you can see here my team. We are 15 persons working with the green transition in the hospitals. And primarily focusing on the things that we use in patient care. So it's like medications, devices, medical technology, and so on. I have colleagues that work only with the green procurement and the supply collaboration. I have 4 colleagues that work with the environmental data and LCA reporting and qualification of the projects. And then we are several persons working with the clinic-based green transition and the innovation and competence development. And that's me. And my colleagues. So if you just change the slides. Yes, a little background on this. The goal in the capital region is to halve the carbon footprint in 2030. And 70% of the emission comes from the products and medications that we use in patient treatment. So it's not because we're not working with energy and other transportation and so on, but we have to look into the medications, the devices, and the medicines that we use. So we need hospital staff to take action. I think there is coming a little bit more text if you just click. Yeah, we need hospital staff to take action. We can't do this alone from the our section, so we need all the hospital staff to be engaged in this. So I'm going to tell you a little bit about how we do that.
There are any questions in meantime? Yes. That's interesting. This goal of reducing the footprint by 2030 in capital region is a goal for the whole region, not for the hospitals only.
It's a goal for the whole region. Yeah.
And you are just taking action to add to this objective, to this goal.
I am taking actions to act towards this goal in the hospitals, focusing on the medication, the medical devices, and so on, everything that is being used in the hospitals. Yeah. So you can change the slides. Just a little bit on the strategy. In order to reach the goal, we need the hospitals in front. We need them to take responsibility for this. We need data. We need a lot of innovation and solutions, rethinking. We need more research, and we need a lot of communication. So I'm going to tell you a little bit about how we work with that. So you can just shift to the next slide. This is how we have built the program up. This is the Green 2030 program, we call it. We have defined 24 initiatives that have been decided and have been accepted by the directors of the hospitals and the centers and the politicians. So we are working with them. A lot of the climate actions are hospital driven. That is, the hospitals take responsibility for them and we support them somehow. Then there are the center driven initiatives. We have a lot of employee driven initiatives. That is, the nurses and the doctors and all the hospital staff also need to take actions in order to reach the goal. And then we have all the prioritizing and choosing wisely agenda. In order to reach these goals, we need a lot of education and skill development. We need some kind of organization and governance around this, communication, financing, green innovation, and so on. So I'm going to tell you a little bit more in depth about how we do that. So if you can change to the next slide. Just to show you which corporate centers we have here in the region. I am based in the Center for Finances, and we are the ones that are supporting the hospitals, and that is because we are in the purchase department. So we are responsible for the purchase of all the devices. So it's, it makes sense that we are based here. Then we have the Center for Real Estates. They are working with more with the energy agenda. The Center for Politics and Communication are helping us with the communication, but actually my team also stands for a lot of the communication. We also have the Center for HR and Education. But actually, we are also running a lot of the courses related to the green agenda, but we have them to support. And then we have the IT and medical technology, which is a central key stakeholder in order to reach the goal. Yeah, next slide. Yes. In order to reach the goal, we also need to activate all the layers in the hospitals. And this is the governance in our hospitals. Actually, all hospitals in the capital region now have a green coordinator. They all have some kind of a green secretary, and they all have green ambassadors. And the green ambassadors are hospital staff from all layers in the hospital. We have doctors, we have nurses, we have cleaning staff, from all occupational groups. So almost every ward in every hospital in the capital region have one or more green ambassadors. So I'm going to tell you a little bit about how we can support them. The staff needs knowledge to be able to initiate and engage in the transitions. We still experience a lot of misinformation about what's important and what the agenda should be. So I'm going to tell you a little bit about how we help them with that. So if you change to the next slide. This is the green staircase that we use to help them, give them some kind of a guideline. What's most important when we're talking green transition in this area, and that is using less. That's the first step on the staircase. So using less, we have to look into every working area and how we can use less. And then the next step is less single use. Where can we shift to more multiple use? And the last step on the staircase is more sustainable products, single-use products. We all know that we can't always use less, and we can't always shift to multiple use. But then the second best thing is more sustainable products. If you shift to the next slide. And then we need some education. We need to educate all the employees in the region. We need everybody to know a little bit about this in order to be to scale the knowledge and scale the initiatives and the innovation. We need them also to have concrete tools so that they can take action. And we need a lot of communication. And in order to communicate, we are using LinkedIn, we are using the intranet, and we're also using Instagram. And we need them to have access to data so that they can prioritize and motivate. And I'm going to tell you a little bit about how we do that here in the region. So if you change to the next slide. Yes, we made an e-learning, which is for all employees in the capital region. It gives them basic knowledge and literacy on climate and green transition with the focus on the consumption. The goal is to change the mindset and make awareness of purchase and consumption, how much that means in the green transition, and aligning the knowledge to all the employees, and to support the hospitals in reaching the goal. The next step I can tell you a little bit about. I think there is a picture coming in if you click one more time. Thank you. The e-learning consists of 3 modules. The first module is a general focus on health, disease, and climate changes, how health can be affected by the climate changes, because that interests the hospital staff. Then there is a module on carbon footprints, where the carbon footprints comes from in the hospitals, because most people think that it's from the transportation and the energy, but actually it is everything that they use that we have to begin to look into. And then the last module is concrete actions that they can take. This is how you can make a difference. So we're giving them kind of a guideline in what can you start with in your ward. Yes, and the next slide. Then we have a attendance course that is for all the green ambassadors. And we started with appointing like 180 key persons. I think we have already 160 through those courses. And the course is made to expand the understanding. We need someone to be the driver of these initiatives. So they need a little expanded understanding of this. We help them facilitating green transformation projects in their own departments. And we give them some tools to be able to share the knowledge so that they can go home to their own ward and share the knowledge with the colleagues. And then we're giving them networking. The course is running over 2 days, and then they have 1 day of field work. And if you shift to the next slide, they have to prepare before they come to this course. They have to complete the e-learning, it's mandatory, and they have to bring a relevant case. So we actually ask them to bring a case, so they have a concrete case that they're going to work with, and we follow up on this case. So in that way, we make sure that they actually do there's an output from this course. And then, we need them to involve the manager. That's, this is how we inspire them. On this course, many of the cases are some innovative ideas that the hospital staff come with, but some of them need some help. So we have actually developed this green handbook. And it's a handbook with, I think there are 22 initiatives in the handbook right now, 3 more coming. And it's an online handbook where every hospital staff in the capital region can go in and see a guideline for an initiative in order to be more sustainable. So they can go in this green handbook, and there is a guideline in how do I implement this step for step. Yes, and then we discovered that a lot of the hospital staff don't read the news on the intranet. They don't follow the news on the LinkedIn. So we thought, okay, we need some other communication channel. So we actually went on Instagram, and now we have a profile on Instagram where we share stories and initiatives to inspire them. And we actually have a lot of engagement in this Instagram profile. People are very excited to follow the small clips that we have. So we actually can scale a lot of initiatives through our Instagram profile. Yeah, that next step. Then in order to support them with some data, my colleagues made a dashboard with dynamic data. So every hospital staff in the capital region can go in this dashboard, and they can see the status for the carbon footprint from what they purchase in this data overview. And if they're working with concrete actions, that could be actions from the Green Handbook, they can monitor the progress. How is it going with the initiative? Are we actually buying less or buying the right products, and how much carbon, how is the carbon footprint getting better? The next slide. Oh, yeah, you can just switch to the next slide. Yeah, I think that was it from me. Thank you for your time.
Thank you. That was very quick and very comprehensive. If there are questions, Monica, you want to say something, ask question?
No, it was just the acknowledgement and appreciation.
That was okay, clapping, okay. Thank you. I have questions because, first of all, looks like you are very advanced in region-wide in introducing this green approach, I would say, to managing hospitals. Is it kind of exceptional for Denmark, or this kind of programs are being run all over the Denmark?
Yes, these kind of programs are run all over Denmark, and we are sharing knowledge in all the regions, actually, yeah. I think that Sweden also has some kind of programs that look like this, that I know of, yes.
It's interesting also to know I assume that after being already in the program, you progress. I don't know for how long are you doing this program? In years or months?
The 2030 program has been running for the last, I think, maybe 5 years. They started up. But the progress has been accelerating the last 2 years, I would say. So it's been more structured, and those initiatives that I was talking about, the climate actions, were the hospital-driven and the corporate center-driven initiatives have been rolling since last year. So it's a lot of those initiatives are pretty new.
And which brings yet another question. I understand that you are now able to do, and probably you did, some kind of cost-benefit analysis of implementing such a program in a hospital setting.
That's actually not something that I have been involved in, but I believe there has been a cost-benefit analysis back then. Yes.
Because that's very important factor to convince other hospitals or regions like ours to engage in something like that. It's like I think it's in many discussions this type of approach is considered to be the cost generating. And the benefits are not so clear. I mean, there are general benefits like reduction of CO2 emissions, but people are not actually appreciating this very much in person. And then from the perspective of business model or, let's say, economics of individual hospital, that would be mostly the cost burden.
A lot of those initiatives actually are cheaper than the actions that we are doing. We're working a lot with using less. So using less usually costs less. So that's something that we talk about a lot. So a lot of those initiatives are also doing less. You know, where are we over treating patients? Where can we scan them less, and so on. And also, if you look at the using more multiple than single use, when you look at the bigger perspective, it's usually expensive when you are purchasing the multiple use devices, but in the long term, it's usually cheaper. So we always make this kind of a business case for the bigger projects to look into, okay, what is the cost benefit of this project? So actually, the managers are interested in this and backing up because they can see some.
And last question, because obviously we are together in the one project, in which we will introduce to the hospitals the method, the tools for to optimize the management of medical products, to shortly. But there is a big difference in your setting and our setting because you are so much advanced and people, we may say, are aware, and we are kind of introducing the same kind of approach, being not prepared to that, at least not as much prepared as you. So one piece of advice from your side, what we should focus in order to make this project effective on our side.
Information and communication is essential, I think. Educating the staff and making them aware of what it means, and also that it's not only the carbon emission that we're working on here. It's also resources and it's economy also. So and think about who are you involving? Are you talking to the managers or are you talking to the hospital staff? The hospital staff usually are more focused on the carbon emission, where the managers are more focused on the finances. So who are you communicating with, and what are you communicating to them, and use the right channels to communicate. So information, and the right information. And my advice is to involve someone who might have a healthcare background, because our experience is that many of the hospital staff listen more to people with the same background. So if you have someone who can translate the information from the environmental specialists, that's really good.
Okay, thank you very much. I think that we need much more advices than that one, but this is very good. Thank you. So now we will go to the next, our keynote presentation with Polish perspective. And in that case, thank you, Sława.
Thank you very much.
And now we will have Anna Gawrońska. Anna Gawrońska already participated in our meetings, but from totally different perspective. Now she's in Mother and Child Hospital and deals with innovations in that case. So most probably we'll be not talking now now about green transition, but implementing innovations, medical innovations to hospitals. But we will see. Anna, the floor is yours.
Okay,
Do we have your presentation?
Yes, I have my presentation, and if I may, I'd rather present myself. I mean, I will try to share my screen, if I may. Just let me know if you can see my slides. I will try to make it full screen.
Yes, now it's okay.
Okay, great. Thank you very much, Kazimierz, and thank you very much for this kind invitation. And this is true that I've been working for Institute of Mother and Child. However, I joined the hospital quite recently, and but this is a great pleasure to be here with you. Although I am only virtually, but yesterday I was traveling home back from Warsaw because we had our 4th edition of our contest, and I will tell you more about our initiatives in the course of my presentation. So I will be focusing on, yes, some barriers, but I would like to conclude with some solutions down to hospitals of the future. So I will begin with some information that probably we all know as citizens of Poland and as of users of different medical services in Poland. However, I will also show you some numbers showing the progress and also the perception of Polish hospitals when it comes down to innovations. And just a couple of words about myself for those of you who don't know me. For 20 years, I've been involved in the healthcare sector in Poland from different perspectives, but my general mission, so to say, is to help Polish hospitals implement different digital solutions. And now I have this honor, because it is an honor to work for the Institute of Mother and Child. So hopefully we will make even a bigger progress. Although, as you during my presentation, we are one of the pioneers when it comes down to promoting the idea of implementing different innovations in the Polish healthcare sector, not only among hospitals, but generally speaking in the ecosystem, so to say, of the healthcare industry in Poland. So, of course, this is a question that we should not ask ourselves, because we all know that we need some kind of progress, and we need different innovations and different technologies to make this progress when we talk about the future of hospitals. Nowadays, we are unable to imagine different medical entities to work, to operate without technology. However, we are in a bit tricky situation, I would say, in Poland, because yes, we are under a big pressure, I would say. We have different challenges that we are all aware of, like aging infrastructure, staff shortages, but on the other hand, we also face rising patient expectations. I'm not saying that this is wrong, but this is something that we have to tackle, something that we have to address. And here again, we can talk about implementing different technologies. What is also happening, and this is not only relevant for my country, for our country, and for Poland, but this is also relevant for the whole European Union. We observe, for example, demographic shifts. We also have to tackle different regulations. And here on my slide, you can see European health data space, but we all know that the healthcare system is highly regulated. So we need to find out solutions, technological solutions that are not only of innovative character, but that are also compliant with legal requirements. And we should also mention some global trends. We want to be up to date to what is going on globally, not only in the European Union. So the discussion about the future of hospitals is definitely necessary, and we are, of course, not only talking about infrastructure, about a building, because this future hospital of the future, this is not only a building, this is people, this is technology, this is definitely much more than the building itself. And here, when it comes down to, again, to some barriers, we can definitely divide them into different groups. I have already mentioned these infrastructural difficulties or challenges. What we are also discussing in Poland, although when we have a look at different European reports, for example, we are quite advanced when it comes down to digitalization. However, we do notice some gaps that we need to fill in, so to say, when it comes down, for example, to electronic medical records, to exchanging different medical information, patient information between different entities, but also when it comes down to clinical decision and support systems that help shorten this response time to patient needs when it comes down to medical services. And one thing that I would like to mention, this is also quite an important barrier when it comes down to making bigger technological progress. This is IT interoperability. And this is a general problem, I would say, in many European countries, and in Poland we also face this problem. Although all the systems that are implemented in Polish hospitals, they do use, for example, HL7 standards when it comes down to medical data exchange. However, we still lack this interoperability when it comes down to information exchange between IT systems that are provided by different IT companies. So I would like to continue on these key barriers. We also have these human factors here when it comes down to implementing technology. Even yesterday, when I was in the institute, in the hospital, we were discussing implementing barcode scanning on the level of the pharmacy in our hospital, and we were also wondering what kind of attitude we should expect from pharmacists, for example, and what the level of acceptance will be. So this willingness to change and willingness to adapt new technologies among the staff is also very important. In fact, I would say that this is crucial for any success when it comes down to implementing different technological solutions. In the previous presentation, Kazimierz, you asked the lady from Denmark how they persuaded the staff to change their approach, to change the processes. So I would also echo what has already been said, that this communication, training, and talking to people is crucial. And I liked most this expression that we should translate the, so to say, professional language to the language of the healthcare system. Myself, I'm not a medical doctor. However, I've been working in this industry for so many years that I think, and or at least I hope that I do use the healthcare language, if I may say so. And of course, as in any country, we also talk about these financial constraints. Especially recently, we've been observing different, or we've been witnessing different discussions regarding investments in different implementations in Poland. So I think that this is a very crucial problem, because if we want to, this is like quite obvious, but if we want to implement something, nobody will give it us for free. So we need to have financial support, and also support from, I don't know, Ministry of Health, Ministry of Digitalization. And now I would like to turn into this more positive side, or positive aspect of my presentation. So we've been asking ourselves a question: what these hospitals of this future approach, what this should look like, and on what aspects we should concentrate. So definitely we've been observing, and I think that everyone would agree with me, this patient-centered approach. In the beginning of my presentation, I said that this is also a challenge, these raising expectations from patients, but I think that this is good. We should start thinking or reminding ourselves that patients are the crucial aspect of the healthcare system. So this is something that we've been observing in Poland, definitely. As I said, we have also made a great progress when it comes down to this digital integration, and I think that this is really proved, so to say, in this European approaches and European reports, when we can see that we are maybe not in the top 3 countries, but we have made a great progress. I remember myself when I went to Estonia many years ago. I think it was like 2010 or something, and I was shocked how digital services can be provided to citizens. I'm not saying that we are at the same level as Estonia many years ago, but I think that we really made a great progress, and we have different digitally integrated services that we can really be proud of. What we are also thinking of is this safety and efficiency. So we are trying to combine those things, and we are trying to look at technology as a tool, as a method of helping us gain this efficiency on different levels and in different perspectives. And I'm really glad that I also included sustainability in my presentation, because this somehow refers to the previous one. We also started these discussions about green technologies. This is a bit difficult as well, because this also needs some kind of mental change and different changes in processes that we are performing in our healthcare entities. However, I'm observing myself rising technologies. So this is not only about implementing anything, but it's about implementing the technology that is not only helping us, but that is also sustainable in different aspects.
We are a little bit ahead of time, so quick question about the previous slide, and quick answer, please. Is this specific for Polish situation, or this is kind of general vision, and those let's say bullets, they are actually true for any type of setting in every country?
I would say that this is relevant. I'm observing what's going on in different European countries. So I would say that this is a European trend. So I would not only concentrate or limit it to our Polish vision. I would say that this is true for any European country. This is at least my experience and my point of view. But yes, I would definitely say that this is a European or maybe even a global vision. Okay, so I understood your remark, Kazimierz. I will try to speed up. So we do notice some progress and some attempts, so to say, to change this situation and to limit or reduce the number of barriers that we are facing. What I would like to underline is this cross-sector collaboration, and I will give you an example in a minute how this is also changing and how we are trying in the Institute to integrate different members of the healthcare ecosystem. And now some numbers to illustrate our local or Polish situation. So as you see, our Center for eHealth is preparing different reports, and in one of them you can read how Polish hospitals or healthcare facilities, because this is not only about hospitals, but how these facilities assess their digital maturity level. So over 50% assess it as medium, 20% as high or very high. But we can also see that hospitals are currently the most active adopters of different technologies within the sector. And when we have a look at different initiatives that we have in Poland, so we have rising number of members of this innovation ecosystem. We have different industry associations concentrating on, for example, AI and telemedicine, data-driven diagnostics, and the speed of these changes is really very high. Of course, we do have some challenges, but I have already mentioned them, so I'd rather not concentrate on them anymore. But what we are all aiming at is this safer and smarter, but also more human healthcare, because what we are also underlining in my institute is that we are implementing technologies, but these technologies should also have this human face, because we are not trying to eliminate people from the whole perspective. And now I would like to conclude with some information about our activities in the institute, how we are helping speed up this implementation of different technologies. So we have our flagship event that is organized by the Institute, helping different stakeholders to present their innovative ideas and products. And this is called Hospital Innovation Summit. We are discussing different issues, also challenges, but first of all, we are trying to find a solution and to accelerate digital transformation in hospitals. So it's not only about the Institute of Mother and Child, it's about all hospitals in Poland. And another activity is our national competition that was called Mother and Child Startup Contest. And we are offering different mentoring opportunities for all participants of this initiative, of this competition. We also give these companies pilot opportunities, and in this way they have the real environment to test their solutions and to implement them. And here is my team. In the middle of this picture, those of you who are Polish, you can definitely know this gentleman. This is the former head of the Institute of Mother and Child, and now the Vice Minister of Health, and the whole team who's responsible for both organizing the competition, but also responsible for helping our hospital and other hospitals implement different innovative solutions. And we also aimed at building different connections between different hospitals and stakeholders. So we try to connect startups with hospitals, for example, with researchers, with technology providers, and we want to provide and promote different patient-focused solutions that are also compliant with national and European priorities. And here, a picture that was taken 2 days ago, Tuesday evening. at the final gala of our competition. And here in the middle of this picture, you can see the winner of our competition, but also representatives of different hospitals. So the idea is to help the companies test their solutions in real life environment, so to say. This year we have a great number of participants, also from foreign countries, from different European countries. So I would like to invite everyone to take part in our 5th edition that will take place next year, because I think this is a great opportunity to present any solution and also receive this help from. And to conclude, the future is already here. It's just unevenly distributed. Thank you very much for your participation in today's meeting. And if you have any questions, please contact me either by email or by phone. Thank you very much for the invitation again.
Thank you, Anna. Someone wants to ask a question? Yeah, okay.
This is Piotr. In your presentation, can you hear me? Because the microphone is... Okay. In your presentation... in your presentation in the beginning, you focused primarily on hospitals. I'm picking on a particular term. At the end, you actually expanded to healthcare. Do you differentiate between these two? And is your mission to focus on hospitals or on healthcare at large?
Thank you very much for this question. And I indeed did this term mixture, so to say. Well, in the Institute, and I think that our competition and our Hospital Innovation Summit proves that we are concentrating on the healthcare system as such. Maybe not so much on, for example, pharmaceutical manufacturers or medical device providers, or maybe, sorry. I think that we are also focusing on medical device providers, but I would say that we try to concentrate on the healthcare system as such, because we are not alone, in this environment. So if we want to implement any technology, we also have to take these partners into consideration. So in the beginning, I tried to present the perspective of hospitals and my experiences, but this is true that in the Institute, we are trying to have like an overview of the whole ecosystem.
Thank you.
Okay, any other questions? There's probably a lot of other questions, but very quickly one. Very good question about this focusing on hospital or healthcare system, but I think this is an example of the Mother and Child Hospital is a kind of example of leadership in Poland. When we talk to the hospitals, in most cases we hear that it's impossible to do something innovative because of any other tasks and problems to solve, which are considered to be more important than investing in the future. Because innovating is kind of in the future. It's also the question about balancing between risks and benefits of so-called innovating. And how this is in your case? Did you make some kind of? Are you aware about risk? And did you consider how much risk is to engage in some activities, and what will be the benefits anyway from overcoming those risks?
Yeah, definitely. And I think that this is a very good question. And I think that it also helped me somehow explain some other aspects of implementing different technologies. And I would use a sentence that I heard during the gala dinner 2 days ago. One of the representatives of University Medical Center in Gdańsk said that AI, for example, is not always an innovation, and not all innovations must be linked to artificial intelligence. So what we are trying to do in the institute, of course, we are trying to have a look at, and we are trying to think about potential risks and benefits and to try this balance, as you have just mentioned. But we are also trying to see first of all, what kind of problems and limitations we have and what kind of technology we could use. So it's not that we are only thinking about AI, and it's not that I'm against the artificial intelligence. What I'm trying to say is that sometimes a very easy and very well-known technology, like the one that I have already mentioned in the beginning of my presentation, like barcode scanning, is totally enough. So to, for example, provide traceability of medical products in hospital, we don't need RFID tags, we don't need artificial intelligence. In this case, such investments would not be justified. So definitely we're trying to find this balance, and we also talk to people, to representatives of our institute who are going to use these new solutions, these new technologies.
Thank you, Anna. I would love to talk longer, but because we are a little bit late, I will invite Nick to join us. I believe this will be without presentation. This is part is considered to be the fireside chat. So Nick Gouldmont. Okay, I'm trying to be correct. Hello, Nick.
Dzień dobry.
Hello, Nick. Anna actually provided at the beginning of her presentation very good kind of hack to this part, because we are going to talk about the need. What is this, and why we need the systems thinking in healthcare? And she said something like, "The hospital of the future is the one which has to listen, learn, and adapt." How would you comment on that?
Well, yeah, I think these are characteristics which should be there in order to change. But the systems perspective is also connected to the reality that even small things, if you want to change in an organization, or if you want to improve in a regional system of innovation and healthcare, you need often to think from a systems level, because single solutions often doesn't work or won't upscale because they are so much interdependent to all kind of other elements like financing, regulation, but also support from policymakers or a governance board in a hospital. So this is the reality we experience over the last decades with changes and transformation in healthcare systems. So you can talk about implementation of an app or healthcare records for better integrated care, and that's nice. But often the sort of idea on, okay, how can we make it work? And that the implication is that you have to think not only at, let's say, an operational level, but you have to think about an organizational level. Often there are regional aspects and national aspects needed in order to make the change happen. And this is often overlooked. And also, if you look to the sort of examples across the globe, across Europe, usually the successes are very much dependent in a more, let's say, holistic overall approach for change. Rather, you do that as an individual department or hospital or even a region.
Yeah, thank you. I'm pretty well accustomed with the systems thinking, but I think a lot of people are not. Although I believe everybody is kind of system thinker, but from the other perspective, we don't appreciate that. We don't recognize that skill we have from the really very beginning. How would you describe what is systems thinking?
Well, system thinking is really that you take into account all these aspects when thinking about improvements and changes. launching a product. And so we know that hardly any startup is successful in healthcare. So less than 95% of all the startups initiatives we saw over the last 20 decades has really became very successful in healthcare. And it's not because the ideas are bad or there's no need, but there is no, let's say, system in order to adapt this in a proper way. And usually one organization or one innovation cluster or even one country is often not sufficient. So on one hand, you have, let's say, the developers, the innovators. On the other hand, you have a sort of adaptation, a market, if you would like, but it's extending beyond the concept of a market. You're talking about the healthcare system, which should be able to adapt this solution. And when it's fragmented, it doesn't work. And with fragmented, I often mean, often the reality is we see a lot of fragmentation in services. So if you take, for example, working on breast cancer improvement, and you say, okay, I have an app which can help a patient to better navigate their treatment journey. The reality is, if you want to take care of better, want to provide better breast cancer care, this is not only related to the hospital or the pharmaceutical. It's about how the prevention is taking place, how the recovery, going back to work, and so many other aspects we are not, let's say, hospital or medical oriented. And so this is at the service level. Then you have the technology level. That's often also fragmented. So how do you collect and integrate data from social care, not only from the hospital where you're treated? How can this be connected to maybe a social network, which is relevant for the patient, for the success of outcomes? There might be in regulation fragmentation. So in many systems, the reality is the system is fragmented from a service perspective, technology perspective, legislation, governance perspective. Organizations don't work together. So if this is not solved, the solution will be not successful. And these are one of these, let's say, important aspects, while innovation is failing almost globally. Also, there's a lot of talk about the US, it's much better. Usually it's not. There's a lot of money available from investors and there are investment rounds. But really, if you look to the uptake of solutions in the US, it's not that much better than in Europe or in China or somewhere else. So the implication is, so either you have to improve this at the regional level, and this we have good examples across Europe, or even better, you look at the country level, how you can further, let's say, align all these elements for a better innovation and transformation environment.
We are talking about that because of the book you recently advertised and the chapter in this book in which you address this the systems thinking need for the healthcare. And you say in this book, in this chapter, that it's not a problem of technology, it's a problem of actually fragmentation of approach to apply this technology. Can you provide an example of a good example of alignment which helped to implement a good technology, a good solution, not only technology itself, single technology, but the good solution?
Yeah, so many can be said on that, but one of the elements is that the basics, the platform, if you like, should be in place. So we have a problem in healthcare in data exchange, not necessarily within the organization. It can be a university, hospital can have a wonderful system which they can communicate internally, but it's across organizations. How it's connected to primary care, how it's connected to social care, or any other elements which are relevant for improving services. So there are regions in Europe, if you look to Galicia in Spain, and in general, Spanish regions are doing quite well, the Basque Country, Catalonia, but also if you look to Italy and the Veneto region in the close to Venice, these regions are let's say, are examples of how you create a data environment which is well connected to different elements which are needed for improving uptake of solutions.
At the beginning, Svava also presented solution in Denmark, capital region in Denmark, which was kind of presentations of very advanced systems thinking in the application of this green objectives or green goals to the healthcare system.
It was a very nice example, and one of the so I think this approach makes sense. We have something similar in the Netherlands, but also there are problems. So this green, let's say, sustainable hospital is really a hot topic. So you see a lot of organizations jumping on this topic with nice marketing approaches. So in many initiatives, it's mostly the marketing, so-called innovation managers who are doing this. But if you're actually looking at the operational level, if the board is not really supporting this, there's no money allocated for the operational staff to do the proper things, the thing won't gonna fly. And maybe this is in the Copenhagen region, it might be different. But if you want to launch an initiative such as this, it does not only take a communication strategy, it needs also properly funding, it needs action plans. And I think the Danish plans looks really good, but I'm always interested also how hospital staff and also primary care and all the other stakeholders in the process are really engaged and really are part of this transformation process. And this is actually the challenge we're looking at in countries. How do we mobilize the people with a shared vision, with concrete, let's say, actions to make it work? And there's also where Poland can make a difference. A country in the Netherlands, they are totally stuck. There's no transformation happen. There's a lot of talk. There's a lot of academics claiming they're creating successes, have wonderful examples. But in reality, like the UK, we are stuck in a totally inert system because it's so fragmented. There is no shared idea on how to move forward. There's so much interest conflicting. So I think what Poland, and also I work a lot in Central Eastern Europe, we have an opportunity to make the change happen. Because we have a different history, we have huge challenges, but we have also relatively a sort of dynamic which we can make the change. But this really requires a different approach from the history we're coming from. And so collaboration, as what Anna and Shwava was saying, so we need collaboration. So all these egos within the system and want to be the sort of macho innovator or macho professional, we should overcome this by strategies, clear strategies, support from the board, proper investments, and we need a really smooth project management approach to make it and to help the operational staff. If we don't get the buy-in from, let's say, the local staff, you create, let's say, independent islands of innovators, and they meet and they have wonderful conferences, and it's a great atmosphere. But it's a bubble which is not really connected to the reality. So this is, I think, a sort of key experience wherever you go across the globe to make it happen. I think I work also in China. There you have a more central-led, let's say, innovation. It's something we can often not apply in Europe or in the US. But there, yeah, you see huge changes at scale happen. We don't have to need the same approach, but we need to find a sort of common share endeavor on all these elements to make the change happen. And this, obviously, leadership is quite central in this.
I just wanted to ask about your experience with Eastern Europe, because as you mentioned, you work a lot. Do you find that some kind of good examples of systems-wise change in healthcare?
As you know, in many countries, politically, there are rather some challenges with fast-changing governments and ministries of health. So there is political dynamics which make it not always easy. But take, for example, Moldova, how the country, despite all the challenges and problems they have, they merely make huge steps in digitalization, implementing solutions like e-prescription, like Poland had over the last years. If you look to Slovenia, also key examples of how a healthcare system should work, they built over the years. And also they have a very different dynamic, for example, to the Netherlands, which they really want to make improvements. Also Romania, if you look to, for example, the National Cancer Plan, how they worked with public and private partners, with industry, to make a sort of plan for the future and working on implementation. It's a key example for whole of Europe. So there we can learn from those examples. And I strongly believe that you need a European national strategy, but eventually it is at the regional level where the actual action and the impact could take place. And Silesia, Higher Silesia, I also work in Lower Silesia and in Wrocław as well. You can make a difference, but really consider carefully on how do you align all the stakeholders, try to balance all the interests from the different stakeholders, and make it actionable with action plans.
Okay. I have information that I should invite also other people to discussion, which is okay, and I expect that there will be more questions. But if you are not, I still have some. Please, if you want to take a voice and ask questions, discuss with Nick something important, please do that. Don't be afraid. You didn't mention before in your previous part of talking in relation to system thinking. You didn't mention about learning, the process of learning. But I know that a lot of people know that his first book by Peter Senge, The Fifth Discipline, which is system thinking, is actually the book about learning organizations. Because everything can be learned. We are not given this type of solutions. We can kind of develop the solution when we engage in learning. Can you comment on that? And maybe on the good examples of how some kind of solutions has been actually not introduced or imposed, but learned from inside.
Yeah, a very important thing. So one thing I want to connect to this learning. So in order to make it in a region, for example, concrete, you can work with the use cases: breast cancer, diabetes care, mother and child care. So in order to make these strategies really concrete, you have to work with use cases. And typically one look at, okay, what's already in a region? People have some experience in this sort of future approaches, including technology, where there's a sort of willingness to collaborate. So typically in regions, we look at, okay, what kind of use cases are the low-hanging fruit? We have already some leaders and some to make the change happen. So these use cases, you can make really good progress. So for learning, and learning is much about exchanging information, experience, and listen to each other, and the willingness to also to learn is to create trust, to build trust between the different stakeholders involved. You have to cover their sort of interest, and also you have to remove, let's say, typically the barriers, the human factor, which Anna also mentioned, is so important. So you create these use cases, you look at the typical settings and stakeholders and bring them together in order to learn, okay, what should be improved? Where are the typical obstacles? So that's the first aspect of a learning, let's say, environment, use case based. So typically,
Yeah, go on.
So typically for a country like Poland, the lessons learned from one innovation, good example of transformation in innovation, typically you would like that the Gdańsk area or Lower Silesia ideally also could benefit from this. So what we tell to countries is they have to think about an infrastructure by which you can create an exchange network for learnings. What we did in Moldova was also we look at the regions. Okay, how can we create this network setting at the regional level, each working on their own, let's say, use case, but what's the sort of infrastructure where we can aggregate lessons learned, the good examples, the bad examples, in order to exchange this. So I think the lessons learned from learning is first that you have to bring the people together on relevant, let's say, activities. Then you have to remove these sort of barriers for collaborations and learnings. So you have to look at the interest. Often financial interests are a key barrier to, let's say, really change. So you can also use incentives for this. And then you have to think more at a meta regional level, where you from a country can see, okay, we tell at the national level, this is the direction that we go. We leave regions how to do this in practice, but how can we benefit, for example, to professional organization to exchange lessons learned in a proper way, and that you create a lean approach for the country to really adapt and learn.
But the problem with learning is that one that where the systems thinking comes to the play that there is a notion that we can learn from our mistakes, but we very often don't understand that some kind of problems are our mistakes. So we don't learn from action in that case, especially in systemic environment, systemic and adaptive environment. We very often don't understand where are the sources of learning. That's where this systems thinking approach is very important, especially in healthcare, which is very complex.
Absolutely. And I think also a lot of what you see in this innovation community, and also about all these big names like Karolinska and also the Dutch hospitals, they only promote, it's like a beauty contest. They only promote, oh, we are doing so well, you have to do the same, and we can help you, and they want to have some funding for it. And so it's not a reality. I think the reality in Poland, I know Poland quite well. There's so much talent, there's so much energy. So also looking at your own context is so important, rather than like some of the countries do, always looking at the US for innovation or the big names. So I think this sort of sharing the difficulties and use this as an important driver that we can learn from each other, and it's not about a beauty contest, is a really important element.
Okay, thank you. That comes us to the end. I believe we should terminate, but it's this discussion which may last for hours. One thing I remember from the meeting with Peter Senge was that he said nobody is actually planning a system which is suboptimal and provides to the wrong outcomes. We always plan something for good. So are we so stupid? He asked, and said, no, we are systemic. That's the solution, and we have to learn in which way we can address those systemic issues. That's why systems learning is very important. I think it's kind of must to read the book which you co-authored. So we'll be promoting this book and this chapter here in our environment for sure. Any other questions? Okay, I expected that you would. Piotr.
Hello, Nick. This is Piotr. So we always very often talk about shifting mindset. Even in one of the presentations today, someone said that we need to change mindset. You talk about one of the problems that or challenges that we face is this fragmentation. The way I look at fragmentation, it is our doing. This is the effect of our decisions and actions from the past. And I'm also convinced that we have been doing that in a good faith, with good intention. So from your perspective, what are the elements of the mindset that have to change, which we had in the past, that brought us the fragmentation? What are those elements on the mindset that have to change so we do not continue fragmenting the reality?
Yeah. Well, you're totally right. Often we are, let's say, victims of the past, the lessons and interests, etc. So when it comes to change, and this has been well researched and how to make change happen. So there are different elements to it, and one of the first step building block for change is you create a vision, a narrative, which shows, okay, this is the direction we want to go. This is eventually what we want to achieve, for example, in long-term care, in diabetes, in cancer care, or research and innovation strategy. So this is very important to shape the mind, that you, who's ever responsible, is able to formulate with others on, okay, this is the thing we want to go. Of course, you have to involve people in formulating this narrative, to articulate this narrative. But this is really important because, yeah, if everybody understands a different thing from what should be happened, you don't create this critical mass for change. And this narrative should translate into more concrete elements on, okay, usually a vision should be broken down into an action plan. An action plan should have proper funding. You should look at, okay, what's feasible considering the resources, the competences and the skills of people, what is needed to support them, etc. So in my book, I also refer to Ambrose, who developed this sort of transformation model, the ingredients which you should have in place in order to make this change happen. So, yeah, that's a sort of package which provides the framework by which you can develop this sort of, how do you change the mindset and how do you make it concrete by activities. And you're right. And so by actively working, you also make this sort of, you make it real, that it can be changed. And then you have these sort of fine details on how do you support people in making this change, how you reward them, make them feel that they're doing something useful. So I'm referring to the Netherlands as doing really a bad job at transformation. And that's typically, they don't meet all the criteria in making the change happen. So it's also usually when I discuss it with governments, I said, well, if you only want to focus on the vision, and usually they do with marketing strategy, it's going to work. It may be it's a nice marketing approach, but it never translates into concrete action or real change, because you need to fulfill all these, let's say, 8 requirements. So it's pretty straightforward, but it doesn't mean it's very easy.
Okay, thank you very much. I have another question. Okay. Yeah. And another question. In the meantime, I would invite Professor Lewandowski and Monika Ślęzak to join us to say hello. Okay. Because we will start actually smoothly the discussion. So the question is to Nick.
Yes.
But also feel free if you want to add to something to that.
Yeah, in fact, it's an open question because Nick been mentioning like the low percentage of startups being successful and so on. So here, what I want to bring, like 2 options. You think it's easier to start like some technical innovation in a niche, so where it's like a very specialized surgery or something, as we've seen in the morning in the first talk, or actually bringing something very simple that everyone needs and will just simplify their daily work. Because I see these are like 2 different approaches, and I think the answer which one is easier to actually make work is not so straightforward.
No, I think every type of approach is not very easy. There are other sectors which are far more easier. So if you, from a strategy perspective, so it's very much dependent on the type of challenge and the type of solutions. So to give a thumb of rule on this or that, it's not very easy. What I can say, so the opportunity also for Poland is to work at how the market, the uptake will work. Poland can be a leader in medical device development, implementation of solutions. If you do it nationwide, you create this, how can we adapt solutions? So that might apply. You might think how on a nationwide you can create this sort of environment for which hospitals, primary care, home care can adapt solutions from a creative innovation community in Poland. If you solve this issue, you are champion in Europe. It also applies to apps, and so Poland and the Polish government is working on this digital infrastructure. If you are able to provide a platform where you have, let's say, the clinical data, the administrative data, the patient-related data relatively together, and where you can integrate different solutions, whether it's for the hospital or it's for integrated care, in a much, let's say, seamless sort of approach. And you can look at the Ukrainian digital strategy. It was one of the digital healthcare strategies which was awarded as one of the best by OECD and other authorities, where you have a sort of national basic infrastructure, quite similar to Estonia or Moldova, where you have a basic infrastructure which is a public national one, but where you allow private parties, third parties, to integrate solutions based on what the market is offering. So that would be a way to go. So working on this, how to streamline that's really a key issue to make really innovation, adaptation work.
Okay, so the starting point is the infrastructure, on the scale of the country. That's what you're saying.
But it allows collaboration between professional association between hospitals. And usually hospitals, professionals all have their interest in the system, by which makes it difficult to bring up new solutions. So if it's properly done, also let's say the medical community in Poland would sit together and how can we create this environment and overcoming all these interests from this complex market as healthcare, and we can create an opportunity for Poland. So that would be my advice to the medical community in Poland.
Okay, thank you.
Thank you very much. We're jumping to the next. You can stay with us actually and take part in the discussion if you can add something from your perspective. We have Monika Ślęzak and Professor Roman Lewandowski with us, who agreed to share with us some thoughts about in which way we see the implementation phase of those ideas we were talking before in the previous part of this meeting. So please share your thoughts. First of all, let's start with healthcare data readiness. How do you consider this? Are we ready? What should be done on the perspective of local, national level? In which way we are approaching this actually need to share, to be connected through data and to have access to data and to use this data without which actually now it seems to be impossible to further develop innovations in healthcare system-wide. So I'm not talking about only technologies, but about managing a whole healthcare system per se.
Okay.
Yeah, Professor.
Okay, me first. Thank you to having me here. What I would say, because I prepared some presentation and actually at the beginning I really referred to this data readiness, but actually the challenges that we have in sharing the data. Because we are very eager to share the data. In hospitals, we have a lot of data concerning patient treatment, results of the treatment, and so on. But we have this very, very restrict law concerning data sharing. And for example, as it was said before, that startups have problems with going into the market, but I'm actually very eager to implement AI in the hospital. We have several projects. For example, one even with the Sano company. I saw that Paulina Tworek is here. Greetings for you, because I think that it is the person from the project. And this is not the language model, that it is not the problem. It is not the black box. But it is an enormous problem with these black box models. And even though we are eager to implement it from the last 1 year, actually, I'm starting to introduce some solutions to the hospital, but actually I do not manage to do that because of the one simple thing. The information, this data protection officer actually banned this. And one woman just resigned from the job. She said she is not sure that we can share data, even though it was a lot of work about that. The other now working is for 3-4 months, and we do not go one step further. That is, we have ready to share data. We have data, we have a lot of obstacles, especially concerning this GDPR, and this is the real problem. Maybe because can I share my presentation and show what I see, how I see the obstacles, a lot of problems with implementing the AI to the local entities, the hospitals? Are you interested in that, or do you want to discuss more wider?
You can share a presentation, or I can share your presentation for you.
Okay.
I am muting the microphone because we are in a public place and it's becoming louder, so not to disturb you. But okay, if this is a short presentation and provides some kind of insights into the discussion, it's okay to share it.
Okay, that I'm waiting for sharing my presentation, yes?
Okay, just a moment.
In the meantime, I would comment something about this access to data and building innovation on that. A very good example is Finland and Sweden. As far as I know, as I learned, in Finland, some solutions have been implemented before GDPR or AI Act has been proposed by European Commission. And when those implemented, I actually introduced, I heard the opinions from Finnish people that actually they don't have to do nothing because they are ready. Which means they've been thinking, they've been preparing, they've been learning how to implement these solutions to share data, to have access to data before, and that was based on the real need, because that was necessary in the places, in cities which were neighboring with Sweden, but same on the Swedish side, and a lot of people have been working and traveling a lot through the border. And that was necessary to share the data across the border in a small area to provide the healthcare service on the right level. And that provided them to implement solutions which were actually which provide the common sense for sharing the solutions, and which proved to be actually very well prepared to introduce this similar solution in the whole Europe. As far as I know, some of the solutions which are in the GDPR has been learned from their experience. So it's possible that there is a need and actually the good approach to that problem.
Yeah, of course, I agree. But the problem is that every hospital director is responsible for their own activity. And as I see in Poland, there are some different stages of implementing these AI solutions, but this depends especially of the boldness, I would say, of the board of the hospital, because there is still a lot of doubt. But okay, let's go quickly to the presentation, because I would like to draw your attention to at least two main problems. The first was already said, the protection, the data protection, but okay, there will be maybe some problems. And the second is also the problem of actually working with this how to apply this solution is in this cloud, because this is also many doubts. But I would like maybe, because we, for example, solve this by our own service, and we are trying to do it by our own, but I think this is not a long-term solution. Please take the next slide. What the problem, the main problem, apart from this data protection, is firstly how to specify these solutions, because as a public hospitals, as I underlined this in the title, we have to go through public procurement, and then we have to implement actually quite strict procedure how to choose the best offer. Please give me the next slide. Maybe the whole slide together, because if there is, we, for example, identify 6 areas when we can implement AI. The first is discharge summary and medical documentation review. Maybe let's concentrate just on the one example, because the problem is always that doctors spent a lot of time examining last, for example, hospitalization, current tests, and so on, interviews, and how make from this the narrative that at the end will be the recommendations for future treatment. Please go maybe 3 slides. There are other area of implementing, but next slide, please. I don't want to take too much time for you. The next slide. Okay. And for example, as we have to spend public money, we have to select the offer. And how to check which company's solution is better if we are talking about the language models that could hallucinate. It is very difficult to compare. If we have traditional hospital information systems, we actually could focus on some strict features. For example, if the functionalities are present in the system, and for example, how efficient, how quick it is, and so on. Now we have quite different criteria of selection. Please, next. Next, please, because I was prepared to do it by myself. For example,
we have a question from Monica. If you want
No, it was not a question, but maybe addressing some of the comments of Professor Lewandowski, but I'm not sure if shall we do it now or wait until the end of the presentation.
I will try to do it as quickly as possible, and maybe we will discuss it later.
Afterwards.
Yeah, because we actually are in the process of choosing, selecting, and the threshold we already encounter is like how, because we have to test. To choose, we have to test the model. How many, for example, real anonymized clinical cases we have to prepare to test the model? What is the confidence interval if we know that this hallucinate? If we choose, for example, if we have the accuracy 99.9%, then we have thousands of cases to select and to check the best model. That, for example, I see a lot of obstacles just not only in the implementation, but in that we can believe that the results we have are proper. Because let's maybe in the next slide, maybe. Okay, because I may maybe not go into the details as I said before. Please, the next. I would like to show. Okay, please leave that. That firstly, we have to check if the summary, for example, in this example, will be just accurate according to the data we deliver. But secondly, we have to have a panel of physicians who will see the diagnostic accuracy, medical terminology correctness, narrative consistency, and so on. And I'm not talking about the system who will diagnose patients. I'm only talking about the system who will summarize the already existing data, because we know the diagnostic and so on, this is behind us, and probably there will be much more difficult than only this application that I'm talking about now. Please, next slide. Okay, maybe the same, the inconsistencies dedicated what we can, what will be the precision precision stage. Next slide. Okay, next. Okay, please stop. I just participating in a conference 2 or 3 weeks ago, and someone translate the scientific committee in just by AI model. My dean was like University of Varmia and Mazury. My department director was also the University of Varmia and Mazury. Please, next, just click. And I was translated as the University of Wisconsin-Milwaukee. And the next slide, please. Next. Then, but even if we introduce the AI, who will actually check it? And if the AI will be the assistant of the doctor, or the doctor will be an assistant of the AI, that I would like also only draw to the attention to this problem, how to choose and how to check the AI if it is not so deterministic of the traditional hospital information systems. Thank you for the presentation.
Thank you. Monica, would you like to add something quickly? Because I have a very important question. I would say, what does it tell us, what the example you have provided?
If it's so important, then ask.
Sorry?
If it's so important, then ask the question.
I don't understand. Can you repeat again?
Distraction,
If
something
it's
about
important,
this.
then ask the question. Because you said like you have very important question. Then ask.
Okay, so ask your question.
I have to ask my question. My question is actually not the question. It's the constatation that implementing the AI, as we have a lot of startups, we have a lot of emails every week actually that want to cooperate with us, that the implementation is much more difficult even in the administrative part in healthcare than in any other, I think, organization, because we do not, we can't have, we have very narrow margin of an error. That I don't know if it would be possible to implement this new technology in the hospitals. And I would like to start the discussion. What other people think about that? Because a lot of startups now are going into these AI models, especially these LLMs. And I see a lot of problems, challenges to implement it. That's why, as I heard before, so many startups are on the market, but they can't find organization when they could implement their solutions.
I understand you consider this as a barrier to implementation of such a solutions, but also there is a lot of examples that those solutions are being implemented. The sensitivity of the AI solutions is the kind of characteristic which is always present. It will always be present. So it's not an obstacle. Rather, it's a kind of let's say point to consider in this implementation. As far as I know, you are implementing some kind of solutions developed by Sano in your hospital, and you are dealing with the problem. You touched the problem of using LLMs, which is totally discussion about that is of course very large, and that's the one way to implement. My question was, what tells us your presentation? What it tells us in terms of readiness to implement our readiness to implement this solution? Because from I would conclude that we are simply not ready in terms of our competence, how to evaluate those technologies. Here in Poland, I mean here in our system, because in many places those solutions are being implemented, but I never heard about a good solution based on LLM. There are solutions which are more closed ones. Actually, the one like it's being developed in your hospital.
Yeah, because why I mentioned the problem with LLMs, because the project with Sano, it is based on different AI model that and it is still of the scientific stage that we are just implementing it, but not in a production stage. That and I think that go from the scientific stage into the production stage will be a big step. The first thing. The other thing, I have a lot of emails, as I said, from companies, from startups that are trying to implement these LLM systems into hospitals, in different areas. And I would like to take an advantage of this conference to draw the attention where lies the challenges, because I think that the startups are not aware where the challenges are, and they have to be prepared maybe in different way to talk to hospitals than they are doing now. That this is the question: what the startups have to do to be more better aligned with public hospital needs and generally in the healthcare needs.
If I can comment on that?
Please. I think I'm waiting for the discussion.
Because I, as a coordinator of the industry contact point MedTech and Health in Poland, we are dealing and having close interaction not only with the startups, but also with the healthcare providers, including the hospitals. And what we see, it's first of all the two parts of the healthcare, I would say, like we have the clinical and university hospitals and the hospitals that are governed by the local authorities. We see that already here, there's a very big difference in the approach to the innovations to be implemented in the hospital. As you mentioned, it is difficult to do it due to the regulations that we have now regarding the privacy of the patients. But we also need to remember about the EHDS that should be implemented within the next 3 years. So what I see, and this is hope also for the medtech and the startups, to really poke the politicians to take seriously all the regulations and try to implement them, including also the way how the data should be governed. Yes, that was also Nick was mentioning, that here it is important that we have this data exchange that can be used and can be used between different hospitals, because what we see with the startups, it's very often that the solution, they would like to come up with the solution that is available for more than one hospital, yes, that can be implemented at the larger scale. And the problem that they are facing now, that then when they are working with the one hospital, that apparently the solution that they are developing cannot be easily to the next hospitals due to this lack of the interoperability of the data. So for sure, there are some initiatives, and that's what I would like to mention, that are already initiated by the European Commission and by the EIT Health to help startups to understand the needs of the hospitals. And here we see very high interest of the hospitals from other countries, but not necessarily from Poland, to be involved in testing the solutions with the money that are coming from the European projects. And here again, we see that difference between the clinics that are university hospitals and the other type of hospitals in Poland, that for the second group of entities, they are not actually prepared for this type of collaboration. Of course, it's good to have hospitals like you have in Olsztyn, when you have the departments that are dedicated to interact with this new solutions. But what we see, if there are no like public-private partnership departments or people responsible for this partnership, if there are no staff in the hospital that is focusing on this innovative public procurement, it's difficult to implement that. And what we see, there are European projects, again, coming back to what I do for every day. I monitor also all European projects. And even for the next 2 years, European Commission announced the call that is focusing on innovative procurement for healthcare. And I think that that could be one of the options, trying to find, and that also I would like to connect that with what Nick said, try to find this network around Europe and try to see what can we learn from others, like from Denmark, from the Netherlands, try to implement to our local systems, because after this post-Soviet healthcare management, it's the same as in the Netherlands. And that there were already several analyses showing that for the Central and Eastern Europe, it does not work like it does in the Western countries. We have different problems that we are facing in the hospital. You as a director, I assume you know that better than I do. And that should be, I think, somewhere that it should also be resonating at the European level, that there is the same solution for all hospitals all around the Europe. So my take-home message would be for sure to be open for this European collaboration in terms of the European projects, focusing on the innovative procurement systems that could be implemented also in the Polish hospitals, because then with the money that we have from the European Commission, we can also search for the optimal solutions, taking into considerations all the also bottlenecks that we are facing. That would be like one.
Yeah, I totally agree with you, but the problem is that anyway, if we have, because there was a lot of conferences, I was also participating about these innovative solutions. Sorry, first of all, I would say that I'm watching the same cases from the last 15 years, like some washing beds by the robotic hand. I saw it first time at least 10 years ago, and I saw the same case last year, that the innovative solution is good idea, but I didn't saw any steps in the implementation, because as I said, 10 years ago, I saw the same cases as last year, but because there is a lot of fuss. People are talking about this AI and so on. I'm very, very eager to implement it, especially my background as IT, because actually it was quite a lot of years ago, because in 90s, I was employed in a big company and responsible for IT, that it was totally different things. For the last quarter of century, I'm managing hospitals. But going back to you, but there would be very difficult to even to choose in public procurement an AI model, because it is because to compare it as an intelligent entity, we have to make a test, and this test to ensure a narrow interval of accuracy. We have to have a lot of data, testing data, and someone have to prepare. That I would like to say that the process of selecting the best solution for the hospital, also according innovative or not innovative procurement, but the law we have the same, will be much more complicated, much longer, and much more costly, and the medical professionals have to be involved in a more extended way. That I would like to draw attention, where are the problems?
And the question is actually in which way, one of the questions, of course, not the only one, is in which way we can build public trust in data sharing across institutions, even across borders, because that's maybe interesting, important. Nick, you wanted to add something?
I do not see problem with data sharing, because, for example, we in the hospital have this totally electronic documentation for the more than 10 years, and actually we apply to this P1 system and so on. This is in this traditional. I do not see much problem in this traditional IT systems. I would say, I mean, hospital information system and so on, PACS, this kind of system, there are no problems there. There is only how the government is prepared to share the data. There is some security problems, but it is much low. This is only, I would say, technical. That's why I concentrate on this AI, because I think that this is the step ahead that we have to make. this is just the technical problem with data sharing. I think, I don't know on what stage are other hospitals, because actually my background is the IT just back. We are ready to, I do not see problem with this traditional
Many discussions, actually it's taken that it's not technological, it's a human problem. It's a people's problem with data sharing. Nick, you wanted to add something.
No, I just wanted to say thank you very much, Monica and Roman. You see here had a sort of combination of there are solutions, whether they are, let's say, AI and technical or service related, and the procurement side, the market side, which are so important that they are aligned. And also Monica and Roman pointed to the difficulties from organizations who want to use these technologies. How do you do proper procurement strategies? So we have, like Monica said, European networks and programs and instruments to support this. And if we really want to create an impact also at the Polish level, we have to do better in engaging organizations in this type of approach, because this procurement is very difficult. But also it needs to be tailored to different organizations. Gdańsk might need a different solution than Krakow, Warsaw, or elsewhere. So the key message also here, echoing Monica, we have to collaborate. Also at the Polish level, we have to better collaborate on how can we make this market, including the procurement, the purchasing of solutions, make it better work so we have a scale to do that. So I was very happy that Roman and Monica addressed this topic.
Thank you. And Monica?
There was, yes, to follow up what Nick said, there was the project Procure for Health, yes? And there were like twinning action when you could learn, not reinvent the wheel in terms of learning how to write the proper procurement, exactly what was mentioned. But how I understand the problem mentioned by Professor Lewandowski is that to write the proper procurement and the proper specification, first, you need to know what you really need. Yeah. And how I understand it, that now we are at the stage with AI solutions that the best, how I hear it, would be first to try solutions like on a small scale at the institution, if what is really needed, what should be in the specification. And once you have this data and certainty that it works, then you write the specification. Do I understand it correctly? That you would go first for some pilot studies to see what you should look for this public procurement. Do I understand it correctly or not?
No, because I'm really engaged with this AI implementation in hospitals. I'm participating in many conferences, and I saw a lot of cases, but all of them are on. There are some person in the hospital, a doctor who is very eager to implement the AI, and there is some island when the AI is doing something in some ward, some outpatient clinics, and so on. But I think about put it as a system to the hospitals, not that one doctor is doing something and actually he is breaking the law. I think he is putting data somewhere, not sure it is according to all these detailed rules. But this is not the way we have to implement AI in hospitals. We have to do it systematically. But if we want to do it systematically and in large scale, not just as a pilot project, because I saw a lot of pilot projects and they are good. But if we want to take one step further to use the AI as a system in a big hospital where there will be a lot of money spent on that, then the selection of this because we have competitive market and we should choose solutions from competitive markets. Then companies should compete and select and test the solutions it is much more difficult now in these AI solutions than in a previous, I'm now using the word traditional IT systems.
Yes, that's obvious. And I have, Monica, I just wanted to, because to kind of advance and to your sentence, what you have expressed, I have some quick announcement for those who are interested in this area. There is at least one project we know, Healthcare Procurement Network, HealthProc Europe, which is now running on finance from European Union, which offers for us as well the advisory services totally covered by the project. A lot of things can be learned. I don't want to read right now all the benefits which come from that. The service is available for organizations from I'll read now. Healthcare organizations, public or private, that have identified a need but need support to explore and develop the solution through the public procurement. So if you are interested, this is an announcement. Just contact with us. We'll share information. Monica probably knows the project as well. We'll share information in which way you can apply. I see that there is a deadline for applications, mid-November, which means it's pretty soon. So after this meeting, we'll share the information about what kind of the project and where is the link to the details about in which way interested parties can apply for that.
Okay. Great.
Let us move to the second part. I just wanted to remind you that we are discussing those barriers we have identified during our previous meeting in spring. The first was the access to data readiness, healthcare data readiness, and second was actually the digital health literacy of current staff. How would you comment about that? Do we have still this problem? Did we progress recently in that area, or digital literacy is still some kind of obstacle which will protect us in implementing the solutions?
Actually, I do not see much problem in this area, because when maybe I have different perspective. I start to work at the hospital in 1999, and as I was from, my background was IT, I started to implement hospital information system in the hospital. And my experience is that I take a doctor, put my hand on his hand, and we are trying, for example, just to learn to teach him how to use a mouse. This was 28 years ago. Now, there is a lot of young people. They are very good at IT. Actually, I do not see problem with staff, medical staff, and for example, this literacy, digital literacy. I do not encounter any problem with that with the hospital. Of course, we have all doctors, then they have secretaries, and if we want to take advantage of their skills, that I do not see any problem with that.
Maybe that's because you are kind of a good example, good case, and you are on the forefront of implementing digital solutions. But I'm not sure if this is a situation which is kind of average in Poland. I would say the skills are still kind of obstacle. But I would like to hear from others to confess on that, if there are options for confession right now from the public. Monica, if you want to add something, of course.
Yes, if I can comment on that, what we see, and we receive many requests from the public hospital asking for the training or the financial support for the staff training. I'm talking mainly about the nurses and lower staff. in terms of this digital literacy, in terms of this new tools that can improve their work. And because what we hear, and we also try to have this type of this organization is not mainly by the Horizon Europe, but there are like calls Erasmus Plus, and I also know few initiatives led by the Dutch hospitals when they really focused on preparing platforms for the students, young doctors, young nurses, helping them to understand. And that's what we heard also in the first from the first speaker from Denmark. Yes, when you do this even e-learning platform, it helps to get acquainted with the new technologies that are around the staff. And actually, when we look at the age of the nurses in hospitals, it seems that this is still urgent need to improve that digital skills. At least that's what we receive the questions, and these problems is still, I would say, valid, for at least for Poland. I'm not sure how it is in Denmark or in the Netherlands. Is it still the problem or not anymore?
Maybe if I could add one sentence, I'm not talking that people do not training. We are doing all the time that, starting from Excel in the administration, go through other systems. But I'm only saying that as was much experience that people totally do not know how to use the computer. Now they are just, you have to prepare training, you have to train them, but there is no such a problem that, for example, someone is saying, no, I refuse to learn, I'm not going to work on the computer. This is maybe he need more hours of training and so on. But compared to the previous things I said about the AI implementation, it is a minor problem from my side, my point of view.
Generally speaking, it seems to be a kind of vicious cycle, because there is a need for new technologies to be and the new competences to be developed, but there is also those new technologies have to be tested before implemented. So in which way we can learn something new if we cannot actually have it on the daily basis. And the other side, those technologies are progressing very, very quickly. So the question is, in which way hospitals can be organized to keep pace with the educating staff and keeping pace with the development of technologies without disrupting their day-to-day job. That's one of the challenges. Everybody's knocking.
Yeah, but I think that now this constant learning is like obligatory. I think that now when we look at the pace the technology is improving, I think we cannot rely on the knowledge that we gained during the studies. And I think that this is obvious for all. The question is where to find the budget for that, and the motivation for the personnel, especially in terms of this shortage of the personnel. Here's the question of the management team to motivate the staff to take advantage of this technology.
Those who propose new technologies often claim that the budgets are in the hospitals, because if they don't spend on training on new technologies, they will be spending more on other sides to recover costs, unnecessary costs, etc. But it's kind of mind shift in the hospitals, in the hospital management, in which way to to manage this development.
But here, if I can comment on that as well, Kazimierz. One thing that I see is also this awareness of the hospital managers. Yes, the higher the awareness is, and the solutions that they can learn from other hospitals, I think the better. Because I would like to go back to what was mentioned about this implementing AI solutions. Recently, we organized a study visit to Barcelona, and we were in one of the pediatric hospital, Saint Joan de Déu, and what we learned there, they established the system to analyze the processes in the hospital, and they were dealing with the problems on the procurement who should do it, because they thought like, we know best what we need. And at the end, what they did, they hired IT people and they did it internally in the hospital. And now they, of course, they had thousands of problems meanwhile, but they said like, now they have the solution that really fits their needs and was developed in their hospital without doing this public procurement. So it's just to...
Yeah, but we are doing the same, just build a team and buy servers. But I think because I saw a lot of startups and I see that a lot of energy is just wasted because they are trying to do something, they are talking with us, but we can't help them. Because of this obstacle, I already said that my message is to the startup that they have to learn how works the public procurement system and public hospitals itself. Because we just do what you said. We now are building internal team and internal servers, but I think it is the best solution. Why? There are islands. But we do not need islands. We have to build a system for all.
Very good sentence. That brings us to yet another obstacle, yet another challenge, which is bridging the gap between startups and real-world needs. You mentioned already, Professor, that before, that very often the startups which are approaching you, they are not ready because they don't know realities of the hospitals. Can solution be seen in the living labs and sandboxes and similar solutions, similar facilities, I would say, that are implemented in collaboration with hospitals? And are hospitals ready for that?
Yes, I think I can only say about myself, because actually it is very interesting also research topic, and it should maybe be done in the future. But as myself, I can say in my hospital, we are really eager to test solutions. I have even in an hour the meeting with other startups who is promising help with this bookkeeping, with this accounting department, that we are very eager to test, to see. But what I'm saying, we have to think about the next step to build a system that the hospital could procure or buy the systems on the free market, not doing themselves everybody in, because 20 years ago, there are also some islands that hospitals build their own hospital information systems, or 30 years ago. There were some initiatives, but it was not the way that now the hospital information system works. There are just companies who is prepared, have more specialized staff, more capacity in this area, that we should think about how to open hospitals to systemic solutions.
Yeah, that's a good point. We know the example from Denmark again, where all hospitals from the country belong to the LifeScience cluster in Denmark, which means also that and they are open to test. So, which means when the solution is tested in one hospital, this information can be shared in the network very quickly, and the procurement system is then based on the proven on the data, real world data taken from one of the test beds, sandboxes, and that works actually. That makes the life of the hospitals and startups easy. But that would be a good question to the representative of the startups, if we have on the audience. If there is someone who can say something from the perspective of startups, what do you need? That's kind of an open question. I don't know if we have on the audience someone who can speak. Okay, if not, we can skip to the last point. That was the.
I have a question though.
Yeah. Okay.
Can you hear me?
Yes.
So, because I get the point that there should be like more public system, like globally, that allows all the hospitals to collaborate, not to build what you call so-called islands. And previously today you also mentioned that there are a lot of pilot studies that actually are working and they are promising. But between these pilot studies and a public system, I see a huge gap, because we cannot just jump from a pilot study to a pilot system. And I think, that's the question, what should be in between? Because obviously the system needs to adapt, so there should be like a hospital environment that allows new technologies to come. So more maybe from the people who made the technology, what they should think about, to from the pilot study go towards that broader, more established solution.
Okay, I have just an answer to the question. I only would like today draw the attention to the problems and what was said that, for example, in Denmark, yes, there was a net of hospitals who there is some solutions on the country level, I understand, to support the implementation. Maybe this is the way that we have to build, for example, a cloud, safe cloud, for example, where we could put our data. Because anonymization, okay, you know what I mean? It is very difficult, because when you saw the films, for example, the CIA is giving the papers and it's all is black. Yes, on the end and A are not taking in black. It is the same when I'm putting to my officer, data protection officer, the data and said, no, but there is an age of the patient, there is the, for example, place when he lives, and it could be connected in the big data. Actually, the patients could be identified. Please put it out. But if we put it out, for example, if the patient is on the village or on the big city and so on, many data, we lose a lot of information. That because we are not sure, as the hospital directors, we are on the safe side or on the not safe side, just giving the data. We have a lot of data, thousands of records of patients, but but this is a lot of danger to make a mistake in giving someone access to this data. But just to anonymize this, it is a lot of work, a lot of effort. And when I discuss with the specialists of the data protection, they have always doubts that there is too much data.
Okay, I think Nick, you wanted to add something to that? You have a hand up?
Once again, sorry.
I'm talking to Nick because Nick has
okay.
Yeah, thank you very much. No, I just want to, in relation to startups and living labs, so I think that is, we know this can be a proper approach, though it really comes also to the quality of the support staff in whether they cover all these relevant aspects. So so we see a lot of examples where a single product focus is not taking in consideration the service requirements in what does it take to implement a certain solution into a whole process in a hospital or across organizations in a system. So it really comes also down to how much are the support staff, designers, innovation managers are able to really cover all these aspects in the relevant development, but also in the implementation. I think also in relation to the startups, so we also experience a lot of relations between startups and, let's say, users or adapters. That the behavior of startups was really very opportunistic. So in the beginning, I'm talking about 20 years ago, this was a movement. It was the early days of innovation, and you saw a lot of professionals also quite interested in contributing to development processes. But because the startups were so optimistic, hey, so you put effort as a professional in a process, and then the startup is the next day he is to another hospital or to another colleague with a bigger promise on contribution. And so managing relations, and also that you create an environment where there's sort of trust and continuity of developments and activities is also often a challenge we see in living lab approaches. And then, you bump into the implementation aspect. And there, I think you could think in quite discrete elements of doing a pilot, a trial, and then formal uptake. But the reality is more that if you do it in a proper way, you work together with the innovators and the users, adapters, in a sort of co-creative way, iterative way. Also, if you look to successful implementation, you need this sort of iterative approach. So usually the development is part of the implementation. So at some point, from hospital perspective or health authority perspective, you have to decide, okay, we think this is a good approach, this is meeting our needs, the startups are doing their best to deliver it. So it's more like a gradual process of innovation and uptake, rather you do it in a very formal way, to all these pilots, evidence. So it should be embedded in the process. And therefore, I think it's also important that we have to think in Poland, how can we create these networks of adaptation that you can come to solutions from, in Krakow Innovation Cluster, from one startup to further spread out into Poland in a proper way.
If I can continue what Nick said, because I think that we should not forget about the end users, so patients. And I understand all the concerns that the hospital managers have. But at the end of the day, we are talking about the data of the patients. And here, I think this is crucial to really get them involved in co-creation, what was mentioned, because we did recently a very nice exercise with the patients' organizations. I see today that there is the leitmotif of the systemic thinking. We organized the workshops when we asked them, using one of the design thinking methods, what are their needs? And what they expressed as one of many different angles of the discussion was that they don't feel heard by the doctors, by the clinicians, by the regulators, and by the scientists. And I think that it applies also to the patients. And we should think that the new generations are more and more aware of the data that they generate using different wearables, taking into consideration all the digital tools that they are using, that maybe this should not be, it should be more like not push but pull by the citizens requiring from the hospitals to share their data. And that would also maybe make the room for this acceptance, what kind of data can be shared. And I think that EHDS, with the European Health Data Space regulations that should be implemented, that I mentioned at the beginning, that they might be one of the critical part in implementing these innovations. Because when we give more responsibility to the citizens for their data, that they can decide, okay, these are my primary data, these are my secondary data, where can I, who and how can use my data, maybe it will also help to overcome the obstacles that we discussed from the hospital perspective. Maybe I'm too optimistic, that could be the case for sure, but I would also look at this point, because I think that now the citizens and patients are feeling more and more responsible for their health, also requesting more, but they can give more. And here I would be grateful also for your opinion on that, because maybe this is the way also to move forward, to raise awareness, not only among the healthcare staff, but put more and more attention to the prevention area, to the, let's say, society, getting more involved with social sciences into even procurement in terms of the perceptions of some solutions. Maybe that could be the way to move forward. I'm keen to hear your word.
Okay, I think we have to come to the conclusion because of the time, not because of we have explored the subject. It's actually the discussion which may last for hours. I'll quickly summarize what happened today. So we started with the presentation of Sława from Danish Central Region. I believe I explained it correctly. And we heard about a very nice approach to implement green thinking, I would say, so to say, in the hospitals across the whole region. And that was a kind of very good example of systems approach to solve one of the problems we have all think about, which means how to make the hospital place, from one point of view, more sustainable, and from the other point of view, more safe and kind of nice for patients and for personnel. Then we heard the example, and that was the international perspective, which provided us where we have to think, in which direction we have to think when we want to implement something in our setting, especially in the moment that we are already started the project. The project name is Reheal, in which we will be providing hospitals with the tools to optimize for optimization through the procurement, innovative procurement, optimization of management of medical waste in general. And the very big difference, which is easy to notice, that Denmark has been preparing for this type of projects for years, and now they will be implementing something in the environment which is, I would say, ready, and we will be trying to implement the same solution in the environment which is far away from being ready in way of thinking of that, because it's busy, not because it's not ready at all, it's because it's busy with other things and it's not so well organized. So there are challenges here. Then we listened to Anna Gawrońska, who spoke from the perspective of her long-term experience in dealing with hospitals, not as a medician but as a consultant in different roles. Now in a mother and child hospital, which is kind of the leader in Poland in implementing innovations, and that was kind of very optimistic perspective, optimistic presentation. What can be done? Very often we hear what cannot be done, but here was that we are doing this and that's it. And then there was a discussion with Nick Galman about systems thinking in healthcare, how important this is and what we should do in that what should be done in that direction. Again, we have touched the surface of the subject. So I urge you to actually study the subject. If you are interested, I have found in meantime, and not in meantime now, but preparing to this meeting, I have found the training course, free online training course developed by Johns Hopkins Hospital in USA, System Thinking in Healthcare. It's available on Wider, not Wider. I'll send you information if you are interested. So that was the the discussion about systems thinking in healthcare with Nick, and then we engage in a discussion how this can be implemented or how this is being implemented in Polish settings, having two examples, two voices, one from by the way, the America Hospital, very nice name when we talk about collaboration, that we collaborate in Kraków with America, but it's in America in Olsztyn, in northern Poland. And then Monika Ślęzak, who represents the organization, which has kind of a helicopter overview what's happening in Poland in terms of projects, programs, and actual implementation of this type of stuff. We will combine all this information collected here, presentations, messages, thoughts collected here into some kind of report after the meeting, and this will be available on our website later on. And as mentioned, there were two announcements about how you can engage into the projects. One was about this procurement project, European project, which helps organizations from all over Europe to deal with the procurement needs if necessary. So we will provide information about this project to you, and that you can apply for getting the help till the mid of November. It's worth to consider that. And second, as mentioned just before, we can provide you with the link to the course on course on systems thinking in healthcare, developed by the Johns Hopkins Hospital. Any remarks from your side? The final words, if you want. We have some noise now because the restaurant is quite well in public place, and the restaurant starts to be operating in full steam. Please don't hesitate to at least to say hello.
Thank you very much for your time, and looking forward to...
Thank you, Monika, for your time.
Thank you also to having me here. It was nice to discuss. I like discussions, different views. Thank you.
Thank you very much, Professor.
Yeah, and also from my side, dziękuję. And it was great to be here, and I hope to see you soon alive in Poland. Okay.
Thank you, Nick.
Bye.
Thank you, Nick. And we are ending the session. Thank you very much for those